Today is the 1573rd day of uninterrupted daily webinar of Ifph. And before beginning the session, let's have a silent prayer. Hello all. Today is the 1573rd day of uninterrupted daily webinar of Ifph. And our guest is Dr. VIREN NIMBARK, Associate Professor, Department of Surgery, Rajkot Homoeopathic Medical College, Rajkot, Gujarat. And he's a consultant physician having 14 years of clinical experience and 8 years of academic experience. He had an abstract presentation in NOPCON 2021, Noble University, Junagadh, Gujarat, and he is the resource person in webinar series by Sampak, founded in January 2022. And our topic for today is urolithiasis and its homeopathic management. Ifph welcome Dr. VIREN NIMBARK for the session. The session will be for 45 minutes, and after that, 15 minutes, we will be having an interaction round with the speaker.
Yeah.
Doctor, you can start the session.
Am I audible?
Yeah, sure.
Okay. Thank you for my introduction. As per one of the resource person for this renowned IFPH seminar series, web seminar series, I would like to give some light about the urolithiasis. As per the urolithiasis, I will just start my presentation. Please confirm if it is visual. Okay, can you see the presentation?
Yeah, but your voice a little bit, I think you need to adjust your mic.
Okay. Is it okay now?
Yeah, it's now okay.
Okay. So my topic for today is urolithiasis and its homeopathic management. You all know that the filtration of blood is getting done by the kidney, but whenever there is any problem that causing the calculus, that is causing the lithiasis in the renal, that is known as renal stone or lithiasis, that is getting done over the kidney, and it will also affect over the excretory system, that is urinary tract. By term, lithiasis means the formation of chronic concretion, that is calculi in the body. Such lithiasis will also done over gallbladder, as well as many times it is also occurred over the salivary duct in the salivary gland. And whenever it is done over the urinary system, that is known as urolithiasis. It occurs more frequently in men than in women, and majorly it is also in the white people, that is blood. It is rare in children, and it shows a familial predisposition. So there are also the uh, cases which came as a familiar predisposition. If the father, mother, or bloodline predisposition also occurs in the urolithiasis. Urinary calculus is stone-like body composed of urinary salt bound together by a colloid matrix of organic material. It consists of a nucleus around which the concentric layers of urinary salt are deposited. Here it is the diagram for the kidney. Just to understand that the different parts of kidney, uh, so around along with ureter. Ureter will leave the kidney. Okay, this is just one bit for the formation of urine. These are the nephrons which are causing the filtration. In the nephron, there is one part which is known as glomerulus. That is the major causing about the filtration. That is the glomerular membrane which is causing the filtration. The renal calculus is having different causes. Majorly, it is because of the hyper-excretion of relatively insoluble urinary constituents. The major constituents, there are three different major constituents, among of which one of causing the urolithiasis. Oxalate stone, that is also known as oxaluria. In the case of the oxalate stone, the auxiliaria or hyperoxyluria that occurs the other ammonia-like substances. Okay. So, thus, because of those ammonia-like substances, the oxalate is getting precipitated, and then it is causing the calculus. Then it is causing the lithiasis. There are also the particular beliefs like cabbage or green vegetables which are causing the oxalate stone more predominantly, as those are high amount of the oxalate. But it isn't like that because the oxalate in the diet are not okay. So the oxalate stones are majorly getting concentrated, and then it is whenever there is precipitation of the oxalate stone, it is causing the particular stone from the oxalate. Calcium stone is majorly associated with the hyperparathyroidism. Whenever the patient is also suffering with the hyperparathyroidism, or the many a times if there is bone disease like Paget's disease, that is also causing the calcium stone. Mostly the uric acid stone is formed whenever along with the uric acid diathesis. That is also in particular few homeopathic medicines as well. Okay, uric acid stone. The patient having the uric acid stone are also suffering from the gout. Okay, so that is the uric acid. Cystine stone or the condition is also known as cystinuria is very rare, and that is also occurring almost congenitally as the congenital cystinuria, which is also having the only occurrence over the neonate or the pediatric cases. Drug-induced stone are also many a times causing physical in the urine. Urinary pH majorly increases. That is, the urine become alkaline. So, if the patient is on particular particularly whenever suffering from the acidity and such drug induced or medicines which is causing the decrease of the acidity, that also occurring, that also causes the alkaline urine, and it is also physical, it is also causing the physical change in urine and ultimately result as urolithiasis. Colloidal content is also causing the urolithiasis. Decreased concentration of crystalloid, that is in the circulation, if the crystalloids are decreased, and then further on it is resulting in urolithiasis. Urinary magnesium and calcium that is also referred along with the hyperparathyroidism. In the cases of the altered urinary crystalloids and colloids, in such a cases, it is also uh, getting resulted as urolithiasis. Okay. Decreased urinary output of the citrate. If there is decreased amount of the citrate or vitamin C, then it is also resulting over the urolithiasis. Vitamin A deficiency, urinary infection is also one of the cause for the urolithiasis. Urinary infection which also occurs majorly over the female patient, and then it is resulting over the pus formation in the kidney, that is pyelonephrosis, and then particularly pyelonephrosis which is resulting over the urolithiasis. As whenever the stone is formed, it is having that particular center which is formed first. Like the plaque is formed, and then further on it is causing the atherosclerosis. Likewise, in the renal calyx, the center of the stone will be formed first, and then further on, that stone is getting being precipitated from this particular insoluble urinary constituent. Likewise, the pus or colloid or any matrix that is in the particular portion of the calyx, and then further on it is getting precipitated from the oxalate or calcium, and then it is forming the stone. So the stone is not only formed along with the hyperexcretion of the relatively insoluble urinary constituent, but it is also along with the particular some other constituent that is precipitating those uh, constituent, and then it is causing the urolithiasis. Urinary stasis gives the major platform for the urolithiasis, as whenever the patient is bedridden, it is causing the stagnancy of the urine, and majorly it is also causing the kidney stone. The stone is found majorly over the lower pole in the kidney. Okay. In hyperparathyroidism, as we had discussed, there is also the vitamin D, increased amount of the vitamin D or the calcitonin, that is also causing the calcium amount, and then further on, it is also causing the urolithiasis. Regularly in the normal urine per day, almost around 200 to 300 milligram calcium is excreted. But in the cases of hyperparathyroidism or the bone disease like the whenever there is a osteoporosis or the Paget's disease, that is causing the loss of calcium. That is so in the urine up to 450 milligram of calcium is getting excreted, and then it is causing the calcium renal calculus. So these all are the etiology of the renal calculus. Okay. Further on, we will discuss about the different types of the renal calculus. Particularly, there are two basic types of the renal calculus. Whenever there is primary renal stones and the secondary renal stone. Majorly, there are the primary renal stones that is particularly getting occurred over the urinary tract. Particularly, as we had discussed, that one or more than one etiological causes that is causing the primary stone. Whenever there is, if there is any underlying disease condition that is causing the occurrence of the urolithiasis, then it is known as secondary stone. Okay, primary stones are usually formed in the acidic urine, and those are usually consist of the calcium oxalate, uric acid, urate, xanthine, or the calcium carbonate. And the secondary stones are triphosphate, amorphous phosphate, ammonium urate, ammonium magnesium phosphate, that is known as triple phosphate. Okay, so those are the secondary renal stones. Okay, primary stones are the oxalate calculus, or also known as calcium oxalate. It is mostly impacted the ureter and causes the bleeding due to its rough surface. Calcium oxalate is the major hardest stone and majorly occurring over the 70% of the renal calculi. Major cases of the renal calculi are suffering from the oxalate stone. It also causing the hematuria. There may be the deposits of secondary phosphate on its surface caused by the infection leading to the formation of the mixed stone. That is the secondary stone. If the oxalate calculus is getting friction, and because of the friction there is also the hemorrhage which causing the infection. Over such infection, the phosphate is also getting precipitated over the calcium oxalate, and then it is causing the mixed stone. Due to high calcium content, it casts an exceptionally good state radiologically. This radio effect. Those oxalate stones are radiopaque. Calcium oxalate is totally radiopaque, and particularly size say location easily getting over the digital X-ray. Uric acid and urate calculi. Those are very smooth. They are also having the moderate hardness. They varies from the yellow to dark brown. Calcium oxalate is getting the pale color or pale or white. On the section of the stone, okay, sorry, on section of the stone display, wavy concentric markings are present in the uric acid stone. So those are the typical. So by means of the uric acid that is very smooth, those are also not that much radiopaque. So there is requirement of the USG as well for the particular locating the uric acid stone. Cystine calculi are also very much softer comparatively over the calcium oxalate and uric acid. Pure cystine calculi are not radiopaque, but as they contain the sulfur, they are usually radiopaque. Okay, so those cystine calculi are not that much particularly over the X-rays or the CT scan, but majorly it will be differentiated along with congenital anomaly as well as the patient is only the particular pediatric or neonatal one. Xanthine calculi are also totally non-opaque and xanthine stones are rare. Calculi are as well the xanthine and they are also the non-opaque which could be only occurrence over the few only cases. Secondary stones, as we have discussed, that triple phosphate calculus. Okay, so thus triple phosphate calculus, yes, the triple phosphate calculus, that is the secondary stone, and the many times the composed calcium oxalate along with the phosphate, that is calcium ammonium magnesium phosphate stone. Such secondary stones are majorly formed along with the infection over the calcium oxalate. Okay. So this is only one just to understand that how the stone is getting passed through the excretory system. It is formed over the kidney, passing through the ureter. So majorly the painful component.
Okay, so in this animation, I have just taken up that how the calculus will get passed through the whole excretory. Yes, so when the stone is in kidney, there is quite a less painful, but as soon as it move or it will enter inside the ureter, there will be comparatively more painful condition. It will pass through out the whole course of the ureter. It will came from the back to the front lower, and then it will enter inside the urinary bladder. Till then, it will be most painful. Yes. So. Now we will discuss about the clinical symptoms, clinical features, and in which the symptoms wise, the cases of renal calculi or urolithiasis are divided into 4 groups. I will just stop my video, so probably it will be less uh, interrupting. Okay. The first phase, that is the quiescent calculus, majorly the staghorn stone. Okay. The staghorn stone are also whenever the particular stone is lying inside renal pelvis, as in our previous slide. Okay. Okay. So over whenever the stone is lying over the renal pelvis, that is over this area, that is known as renal pelvis. Number 2. Okay, so whenever the stone is lying over here and majorly the calcium oxalate or the phosphate stone is also getting inverted from the renal pelvis, it will be also getting throughout the whole portion. Okay, so this much portion, whole portion is getting blocked, obstructed by the stone in calculus, and then it is known as the staghorn stone. Over such condition, over the staghorn stones, that is majorly the quiescent calculus. The phosphate stone may lie dormant for quite long period. During this time, the stones gradually increase in size with the destruction of the renal parenchyma. That is very destructing as there isn't any pain, so the patient may also don't know of the particular pathological condition, particular urolithiasis, and then it is also damaging over the renal parenchyma. Over such condition, that is very much harmful. That is also very hard to be managed. Second type, that is painful renal calculi, that is mostly coming to us. Okay, in clinic, the pain is also having the 3 different type of the pain. As we had seen in the animation, the fixed renal pain, that is typically over the renal angle, lumbar region, back portion, one particular spot that is painful. Fixed renal pain. The pain is situated in the renal angle posteriorly and in the corresponding hypochondrium anteriorly. So particularly over the hypochondriac. So either it will be over the right or left hypochondriac. If there is bilateral renal calculi, will be over both sides. That will be also over the fixed renal pen. Whenever the stone will move and it is causing the ureteric colic, it enter inside the ureter, radiating colicky pain due to the reflex pain which takes place along the course of the iliohypogastric and ilioial nerves, which are the somatic nerves of the same segment which supply the autonomous nervous to the head. Whole will be the painful. It is also the particularly painful condition of sarsaparilla or the Berberis vulgaris or over the lycopodium. Many major medicines are also indicated that we will also discuss later. But this particular pain will be also subsided along with the constitutional or the particular taking. It is also required. And the referred pain, those are very rare and sometimes referred to all over the abdomen or along with the particular nerve that is supplied to the urinary bladder. Okay, hydronephrosis. The third symptom, that is hydronephrosis, is accumulation of fluid or the nephron, accumulation of fluid over the ureter, and in such a condition there is a lump in the loin along with the dull ache, that is soreness. Okay. In the other different cases, there is also the particular infection which may cause, and that in it will be also complicated. If the stone will move, it is causing hematuria. There will be blood in the major of the ureteric and the referred pain, as well as the whenever the pain will came over the urethra, and if it is obstructed, the hematuria is thus severe. Usually occurs in the small amount, make the urine dirty or smoky during. Okay.
Still, the network is making trouble for us.
Yes. Okay, am I audible now?
Yes, you are audible now. Yes, you can continue. Please unmute.
So now the yes, thank you. Now the signs of urolithiasis. First thing, that is the tenderness. Majorly, it is causing the tenderness over the particular renal angle, that is between the lower border of the 12th rib and lateral border of the erector spinae muscle. Posteriorly, that angle is lower border of the floating rib. And particularly whenever the patient will came, they were also having the acute episode of the renal calculi, and they will also came along with the pain over that particular renal angle. Anteriorly, such tenderness may be elicited above an inch below and medial to the tip of ninth costal cartilage, which is known as the renal point. Okay, that is anteriorly. But majorly, the patient will also eliciting pain over the renal angle. There might be the lump or the swelling over the renal angle. Majorly in the cases of the hydronephrosis or the pyonephrosis associated with renal calculi, swelling is also seen. That is also the oval form in shape. There might be the muscle rigidity along with that particular thing that will be also causing the rebound tenderness anteriorly. So that means rebound tenderness means whenever the patient is getting palpated over that hypochondriac region, and if there is lifting of the hand after deep pressure, whenever the examiner will lift the hand, it is causing the tenderness, it is causing the pain, that is known as rebound tenderness. Okay, so along with the kidney lump, there is a band of resonance which can be elicited. So over the percussion, there is also many a times like the tympanic abdomen. The resonance band is also felt over the posteriorly due to the.
This is the major threat to this program always. The Zoom problems and all other network related internet related matters always hindered with this network problem. Think the arrival of 5G or 6G may be solved.
Yes,
again, yes.
Dr. Ismail. Yes. Yes, Dr. Veeran.
Yes, sir. Yes.
We can go ahead. There's a short gap.
Yes. Okay. Yes. Now just we will discuss about the investigation that over the blood examination, non-proteinous nitrogenous substances are also present. There is also the presence along with the renal function test that will be altered. Urea, if there is uric acid, then it is also increased. Creatinine is also increased. Okay. Urine analysis is also showing that particularly substances, those are the excretories, those are increased. Okay. Radiographical investigations are majorly important. Those are particularly confirming, that is the straight KUB, kidney ureter and bladder x-ray, that will be immediately directly giving about the particular size, shape and location of the renal calculi. Excretory ureogram majorly useful whenever there is a stone in the ureter. If the stone is present in the ureter, then it is useful. Ultrasonography is also useful and mostly getting done along with the ESWL, that we will also discuss later on. Computed CT scan is also useful if the stones are smaller comparatively. Whenever there is cystine stone, CT tomographical scan is useful. Okay. Instrumental examination, that is particularly biopsy is also done getting whenever it is pyonephritis or pyelonephritis, as well as whenever there is excretion of the stone, the examination of the stone is also performed directly to know that which type of stone is performed. Okay. Now, prior to the discussion about the homeopathic management, if the stone is more than 3 centimeter, these few surgeries are getting performed. Priorly, there is a percutaneous nephrolithotomy, but after the extracorporeal shock wave lithotripsy has been occurred, that the PCNL is also many a times getting not performed. Okay. Ureteroscopy is also many a times getting performed along with the PCNL. Majorly in the cases of the staghorn stone, PCNL along with the URS is performed. Okay, we will just skip about this different type of the surgeries, and I will just came directly to the homeopathic management of urolithiasis. There are also the different open surgeries which are also getting done if it is required. Management is also that, as we had also discussed, that oxaluria, calcium oxalate is not that much absorbed, so the dietary restriction is not that much useful, but the fluid intake is always required. The buttermilk is also the major condition that will be preventing the preventing the lithiasis to be reoccurred, as well as it will be also very much useful to excrete if there is any renal calculi. False reoccurrence means a tiny stone was overlooked at a time of the operation, and then true reoccurrence, that the patient renal stone is usually liable to produce further stones subsequently. Attempt should always be made to prevent such reoccurrence. So that's why the true reoccurrence should not be performed, as well as only surgery or the only medication is not only to prevent the recurrence, but the patient should also have the proper diet regimen as well as the mode of living. Now, the homeopathic treatment or the homeopathic management of urolithiasis. First of all, the patient is required to treat it as a whole. There is also the non regions which are particularly over different location of the country, and those are also known in stone belt. So such a stone belt is also in Gujarat, in Kutch region, or the North Gujarat, or the particular region surrounding the Rajasthan. Those are majorly deprived of the pure water, and that's why the person have to drink the groundwater, and because of the drinking groundwater, they are likely to be suspected of the urolithiasis. It is like to be forming of the urinary stone or the renal stone. So there are particularly stone belt which are prevailing the occurrence of the renal calculi, and in such a cases it is majorly requirement to prevent that reoccurrence of the urolithiasis. Homeopathic medicines are also many a times getting useful to prevent the reoccurrence of urolithiasis, majorly the constitutional remedy which is also providing the recurrence, preventing the reoccurrence of the urolithiasis. If there is miasmatic tendency, or as we had just discussed about the different diathesis, that is the uric acid diathesis or gouty diathesis, which is alongside causing the urolithiasis. In such a cases, there is also very good results along with homeopathy.
Finding it very difficult to continue the session.
Yes.
Still, the network is the big problem. Though it was a big. Yes, yes, Dr. Vijay, you may continue.
Yes, yes. Totally uninterrupted network coverage here, but although I am getting just out from the meeting,
Yes.
there is reoccurrence of that getting out. Yes.
That is weak network.
Okay, there are only the few. Okay, I will just conclude with just one bilateral renal calculi case. That was my first case of the renal calculi. Okay. As we all know that there are different medicine, homeopathic medicines useful for the renal calculi like sarsaparilla, cantharis, Berberis vulgaris, Lycopodium, oxalic acid, hydrangea, Chimaphila, Pararia uvarusi. Okay, this is just the case. I also saved this report till now. Okay, is the bilateral renal calculi almost with the size of the 11 millimeter, and the left kidney there is the renal calculi along with the size of the 12 millimeter. The patient have also came along with the severe pain. uh, he is just advised to take the ECLS, ECWL, and along with that they came with the faith in homeopathy, and with the treatment almost around 3 months. He is just also given that different constitutional medicine. Constitutional medicine is given. It is uh, for that patient. Along with the Berberis vulgaris whenever there is acute episode, and the patient have totally cleared along with both kidneys. Okay, so after that particular case, there are also the many other cases that is referred by him, as well as the different cases in which majorly the same approach is also getting done. Okay, so whenever there is the case of the renal calculi, it is required to have the three different conditions to be known. Okay, the first thing, that is the diathesis. Either the patient have came with the uric acid diathesis, which will be easily getting done with the investigations, as well as there are also the different criteria. So second thing, that is to know about the miasm. Am I audible?
Yes,
Yeah.
audible.
Hello. Yes, sir. So
Audible.
I have also, that's why I closed the presentation. Probably it will also interrupting along with that slow internet. There are phone calls. Because of those phone calls, and the phone is getting giving that supply to the internet. That's why it is getting interrupting. Okay. Sorry for those all interruptions, but I have just given. Okay, so particularly till then, okay, so those 5 to 6 years, there are many other different cases of the renal calculi, and mostly in each of them, the three different particular criteria, that is getting very much adequately useful to remove the reoccurrence, as well as there are also the many patients they have done once or twice the PCNL. Those have came with the case history along with the history of the operation priorly done to the 1 year or just after few months, they have also recurrence of the stone. Over such cases, homeopathy have also getting performed well, and in all those time it is getting better and better to have the known idea. If there is staghorn stone, majorly the first prescription will also majorly start with the hydrangea or pararia. But later on, it is always requirement to have the prescription of the constitutional remedy to prevent the reoccurrence. Otherwise, it is also like the supplement. Okay, so I will just stop here my session if there is any question.
Unfortunately, the network problem was the thing that really spoiled your presentation. You took a lot of strain out of it. Anyway, these are the things that may happen at any time to anyone while doing this kind of presentations during webinars. So don't worry about it. We can have what network you are using? Which one?
Vodafone. I am using
Oh,
Vodafone, but because of hotspot is done from the phone and there
oh,
is continuous ringing. Someone,
oh, that.
there are
Oh, that.
two patients are calling me back and back. So
Okay,
probably
that's the
there is
problem.
might be some emergency. I will just call them immediately. But because
Okay,
of those phone calls, the internet is interrupted.
so
And
it's better
yes,
to have some Wi-Fi connection. Uh,
yes, sure, sure, sir.
and that's the reason why this kind of things happen. So no problem. Anyway, next time
Okay.
while presenting, you can do either one thing. You can make a call diverter to some other phone.
Yeah. Yes, sir.
So
Yes.
that
That was forgotten.
somebody could take and ask them to continue wait
Sure.
for some an hour or for 1 hour like that.
Yeah, sure,
Anyway,
sure.
this is a common problem. Common problem that we get into our daily practice. A lot of patients are coming to with this kind of urinary complaints, nephrological
And
problems. Homeopathy can manage all those cases in a beautiful way, but unfortunately, most of the people are not aware of these things. It is a duty of every homeopath to propagate these things among public. Then only
yes,
more and more people know about what is happening with homeopathy in nephrological cases. Anyway, it's the time for discussion. We can have those who want to participate in discussion can raise your hand so that we will allow you to unmute yourself and you can speak to our guest. I think Dr. Hariharan sir is always there to begin the session. Yes, sir, you can add. You can unmute yourself.
Okay, even though the network is not good, your class is very nice. And you have,
thank you, sir.
from your class, I understood that you have a profound knowledge in urolithiasis. No doubt in that. See, a lot of medicines we have, and I have,
Yes.
collected a lot of stones after it is when from this urethra, and it is in
Yes.
my clinic, and I have put it in a bottle, and when a patient
Yes, sir.
comes with this urolithiasis stone in my clinic, I will show them this thing, and homeopathy is doing wonderful job in this regarding. See, there is a lot of medicines we have. See the Osimankanam, Lycopodium, Chinium salt, Charsaparilla, then Artica urens, Terebinth, Hydrangea, see Causticum, Aconite, Epismel, Candari, Siquistum, and Copaiva. These medicines,
Yes,
what I said, have its own symptoms, and we can use it by knowing the presentation of the patient's suffering.
Okay.
See, we can prescribe, and the color of the urine, according to the color of the urine, we can prescribe the medicine. And see, certain stones, see, stone is big enough. It won't go through the urethra and the ureter and we can give this hydrangea.
Hydrangea. Yes.
Hydrangea will
Yes.
break up the stones,
Stone.
and
Yes.
it will pass through the urine. And say calcarea curve, higher potency. See pain through the uric acid. Pain, I mean uric acid crystals. If you give the calcarea curve higher potency, usually I am giving calcarea curve 10
Calcarea carb 200 and higher. Yes, sir.
higher, and I am giving calcarea curve 10 to
Yes.
see to expel the urine. I mean stone from the kidney.
Stone.
Artica urens is the best medicine, so you have to give it as tincture. Artica urens,
Yes.
Shabe tincture. If it is present from the kidney, See,
Yes.
simultaneously you use the Artica urens tincture and constitutional remedy, and it will do very good. And lycopodium we have very
Yes,
easy. So that patient will say to us that, sir, red sand in urine. That is a
yes.
prime in
Red sand in urine. That is keynote of lycopodium. Yes.
syndrome of lycopodium. See, red urine with white sediments. It should be turbid and bloody. That osimum canum is one of the
Osimum can. Yes, yes.
osimum canum.
Osimum.
It's one of the best remedy. See, if the pain is at the end of the urination, that you can use
Sarsaparilla. Sarsaparilla is useful. Yes, sir.
Sarsaparilla.
Sure. Yes, yes.
At the end of the urine, see, if the oxalate crystals are present, usually I am giving natrum phos higher potency.
Higher potency. Natrum phos. Yes, sure.
Natrum phos.
The same is also giving. I am also giving the same.
He also said it.
Yes, yes.
Again, I am telling this. See, the burning micturition is the burning
micturition. Epismally.
Terbin.
Yes.
You give terbin one
Okay.
dose. One dose.
Okay.
See, excruciating pain from the kidney to testicle. That is the
Yes, yes.
syndrome of causticum.
Yes. Okay.
Causticum is one of the best remedy. See, the urine is very scanty and the patient is too much pain, you can use this epismally.
Smarting. There is also smarting and burning pain. It is peculiar to the epismell.
Peculiar to the epismell. Then see, for burning micturition, severe burning, you can use. And that is, these are medicine as according to the symptoms. That is all. Yes, and it will do good.
These medicines are majorly useful whenever there is acute episodes. So if there is acute episode, renal pain, angle pain, then this all useful.
See, if the chronic cystitis is there, you can use Copaiva, one of the best medicines. Chronic cystitis. Sometimes the patient may have the cystitis also along with urolithiasis. And that case, you can use the Copaiva.
Okay.
These are all medicines, and it is an area of homeopathic physician, urolithiasis. Homeopathic.
Yes.
See, only thing is sometimes the stone may be big enough. We cannot that medicine do not do good when the stone is big enough and it is situated in the upper pole of the kidney. That is very difficult in my practice. And I will give the medicine, but sometimes it will crush and the sandy like crystals will go out. Anyway, your class is very good. See, it is urinary calculus. It is homeopathic area. We can do very good. We have very good.
There are very good results, sir.
Yes. Thank you, Dr. Harry, sir, for adding something more to the presentation. Now I invite our president, Ismail sir. Sir is here. Sir was a former principal of Homeopathic Medical College, Trivandrum. So, sir, please add something more to this presentation, sir. You can comment on the presentation also, sir. Please unmute, sir. Right, sir. Please unmute, sir. Yes. Find it difficult, sir. You are a co-host. You can make it, sir. There is some still you are finding it very difficult. Yes, sir. Please unmute. Please unmute. Sir is fine trying, but unfortunately not able to join.
I think meanwhile we can invite Dr.
Yes.
Indranil.
Yes, you can add something more. Doctor.
Dr. Indranil is raise hand.
Indranil sir have raised hand.
Yeah. Sir, can you hear me? Yeah.
Yes, sir.
Yeah. Thanks for allowing the question. Sir, many times what happens, which I have faced over here, I'm in Pune, Maharashtra. The
Yes,
pain
sir.
part, how should we cover during the calculus pain? Because urinary calculus usually give very severe pain, and patients are
Yes, sir.
unable to tell us the direction. Only they show the location and they're in agony. So, can you guide us for that?
Sir, as just we have discussed with Hariharan Dada,
Yeah.
there is always the requirement to know about the urine consistency. So, if the urine consistency is typically along with that, particularly if the patient is known about the urine, then we could also get about along with that particular acute episode. And as he had also discussed, we are discussing about that whenever there is acute episode, it is always getting performed along with the lower potency and infrequency. The medicine should be given infrequently. Water doses are very much valuable over such an acute episodes. Hariharan Dada is also saying something. Please, Dr. Hariharan sir.
That is a problem. My doctor doubt is very correct. See, usually I am also facing such a
Yes.
condition. See, usually I will do, patient will be lying, patient have to lie in supine position, and see, a wet cloth packing. A wet cloth packing should be introduced at the region of the kidney. And see, wet packing from fridge, you take the water and put it in some towel and
Wet packing. Yes. Got it, sir.
wet packing.
Wet pack.
And then
Yes.
you give the medicine. If the urine is blocked there,
Okay.
certainly the patient will.
It will be X-rayed. Yes.
And the pain will be relieved, and you give Macphos 3x. That is the medicine. Macphos 3x.
Macphos 3x.
Macphos 3x, 15 1 grain tablet at frequent 15 minutes interval.
Yes, sir. That's what the same in the lukewarm water. I am giving in lukewarm water. Yes, exactly. That is very much useful.
Okay.
That will immediately subside the pain. That is the spasmodic pain. The spasmodic pain will be subside immediately within 2 hours, maximum 2 hours. The pain will be subside.
Okay. That is.
Yes.
An acute case, such a way you can manage the acute case by
Sure.
then you can use the indicated remedy also. See,
Yes,
if
sir.
you can use it.
Then it is getting followed up by the indicated remedy, and constitutional and miasmatic prescription will came also. Yes,
Okay.
it is also.
Then give abundant of water. Try to drink abundant of water. Sometimes the stone there itself, it will go out.
Yes. In Gujarat, there is also the particular customary to drink buttermilk, and it is also very much useful, sir.
Okay.
If the patient will drink plenty of buttermilk, it will also very much useful. So we are also suggesting to drink plenty of buttermilk in the Gujarat, particularly in Kathiawad.
Very good. It is
Yes,
a.
sir.
It is
Anyway,
first time I am hearing this.
Yes, Indranil sir. It is psychotic miasm in renal calculi, but many a times it is psychosyphilitic trend. Whenever it is destructing, it is also causing the hematuria or the pyelonephritis, complicated cases. That is also causing the psychosyphilitic trends. In such a cases, that anti-miasmatic remedy is also required. Sir had just asked in chat. Okay, sir. Thank you.
Yes, that also is a very good answer from Dr. Veeran. And
Yes.
I think it is the time to wind up the session. Just only a few minutes remaining. If anyone want to have a question, you can raise now. Raise your hand. Really, homeopathic case taking is very important while treating, whether you treat gastrointestinal cases or nephrological cases or cardiac cases, you have to find the correct simillimum and then you can move with the pathological prescription if at all necessary in emergency situations. What I would like to add to this session, and I invite Dr. Hariharan sir to say a word of thanks to the session also.
Okay, doctor, your class is very nice, fantastic, very informative. You please come again. On behalf of IFPS members, the doctor is presented, and the lovers, I like to congratulate you and giving thanks. Okay, thank you very much.
Sure, sir. Thank you.
Yes, tomorrow we will have a session from Dr. Aditya Lekstrana, and she will be talking about evidence-based medicine, evidence-based medicine in homeopathy, the need of the hour. That will be another big subject, and that a philosophical one. It's really very, very important subject also. Hope all of you will be. Thank you, Dr. VIREN NIMBARK, for such a beautiful session. Even though there was a little bit of trouble
Thank
in
you,
the due to the network problem, you were able to complete the session in a nice way, and your questions to answers were really brilliant or excellent. And congratulations for that also. Hope you can present some more sessions in the future. There is one advice came to me during the presentation that if at all there is any problem when using the hotspot, you can just send the phone in airplane mode so that no call will come to you, so you can use the network also. Okay. With that, we come to the end of the day 1574. Thank you all. Good night. So over to Dr. Manoj to moderate the Malayalam session.
എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1573 ദിവസത്തെ പരിപാടിയിലേക്ക് സ്വാഗതം. ആദ്യമായിട്ട് ഈശ്വര പ്രാർത്ഥനയ്ക്കായിട്ട് കുമാരി ദേവബാലയെ ക്ഷണിക്കുകയാണ്.
സ്മിതത്തിലും ചന്തം വിടർത്തുന്ന ചാരുശീലേ, മൺതരിക്കുള്ളിലും മാമലയ്ക്കുള്ളിലും സ്പന്ദനം കൊള്ളുന്ന ചാരുസത്തേ, ചിന്തയിൽ വാക്കിൽ പ്രവൃത്തിയിലൊക്കെയും ചിന്തനേ നന്മതൻ തൂവെളിച്ചം, സന്താപമെല്ലാം അകറ്റിയൻ മാനസ സന്തോഷ സൗഖ്യങ്ങൾ സഞ്ചിതങ്ങൾ, ലോകാ സമസ്താ സുഖിനോ ഭവന്തു, ഈ ലോകമീ മന്ത്രമെന്നും മുഴങ്ങാൻ, വിജ്ഞാനദീപം നിറകതിർത്തൂകുമെൻ കാരുണ്യ സിന്ധോ നമിക്കുന്നു ഞങ്ങൾ, കാരുണ്യ സിന്ധോ നമിക്കുന്നു ഞങ്ങൾ.
നന്ദി. നമ്മുടെ ഇന്നത്തെ ദിവസം അന്താരാഷ്ട്ര ധ്യാന ദിനമാണ്. അതോടനുബന്ധിച്ചുള്ള പ്രത്യേക പരിപാടിയാണ്. ഈ പരിപാടിയുടെ ഔപചാരികമായ ഉദ്ഘാടനം നിർവഹിക്കുന്നത് സ്വാമി ഗുരുരത്നം ജ്ഞാനതപസ്യാണ്. ശാന്തിഗിരി ആശ്രമത്തിന്റെ ജനറൽ മാനേജറാണ്, മഠാധിപതിയാണ്. ഷാജിക്കുട്ടിയെ ഡോക്ടറെ സ്വാമി ജോയിൻ ചെയ്തിട്ടുണ്ടോ? ഡോക്ടർ അൺമ്യൂട്ട് ചെയ്യൂ.
സ്വാമിജിനെ സെക്രട്ടറിനെ കുറച്ചു മുമ്പ് വിളിച്ചിരുന്ന സമയത്ത് ജോയിൻ ചെയ്തു എന്ന് പറഞ്ഞതാണല്ലോ.
ഏത് ഫോണിലാണ്? വേറൊരു ഫോണിൽ ഇപ്പൊ കണ്ടായിരുന്നു. ഇതാണ് റെഡ്മി പ്രോ
ഞാൻ ഒന്നുകൂടെ വിളിച്ചു നോക്കാം.
നമുക്കറിയാം അഷ്ടാംഗ യോഗവും 8 അംഗങ്ങളും യമം, നിയമം, ആസനം, പ്രത്യാഹാരം, ധാരണ, ധ്യാനം, സമാധി, ഇങ്ങനെ വിവിധ ഘടകങ്ങൾ ചേർന്നതാണ് ഈ അഷ്ടാംഗ യോഗം എന്ന് പറയുന്നത്. അപ്പൊ അതിനകത്ത് ഏറ്റവും പ്രധാനപ്പെട്ട 7ാമത്തെ ഐറ്റമാണ് ധ്യാനം എന്നുള്ളത്. അപ്പൊ അതിനു മുമ്പ് ഇത്രയും കടന്നു വരേണ്ടതായിട്ടുണ്ടെന്നുള്ളതാണ് ഏറ്റവും ശ്രദ്ധേയമായതും ഏറ്റവും കഠിനമായത്. തീർച്ചയായിട്ടും പറയാനൊക്കെ നിവർത്തിയില്ല. കാരണം
സാറ് ഇപ്പം അൺമ്യൂട്ട് ആയിട്ടുണ്ട്. സാറിന് വേണമെങ്കിൽ ഒരു ആശംസ പറയാൻ വിളിക്കാൻ വരുന്നവരെ.
സാറിനെ ഇടയ്ക്ക് വെച്ച് വിളിച്ചപ്പോ സാറിന്റെ ഫോൺ
അൺമ്യൂട്ട് ആക്കാൻ പറ്റുന്നില്ലായിരുന്നു. ഇപ്പൊ എന്ത് കുഴപ്പമുണ്ട് നെറ്റ്വർക്ക് എല്ലാം.
ഇപ്പൊ ശരിയായി സാർ.
എന്റെ കയ്യിൽ ചുണ്ടുവരലും തേഞ്ഞല്ലാതെ അത് അൺമ്യൂട്ട് ആവുന്നില്ല.
അത് നെറ്റിന്റെ പ്രോബ്ലമാണ് സാർ, അതാണ് കാര്യം.
നെറ്റിന്റെ പ്രോബ്ലമാണ്.
എല്ലാം നീയെ നെറ്റ് എന്ന് പറയേണ്ടി വരും.
നമുക്ക് നെറ്റ് വാങ്ങേണ്ടി വരും കേട്ടോ. ചാല പതാറിയുന്നോ ഒരിടന്ന് വാങ്ങേണ്ടി വരും വലിയ നെറ്റ്. അല്ല ഈ നെറ്റ് കൊണ്ടിന് കാര്യം ഉണ്ടാവുന്നില്ല.
ഉദ്ഘാടനം ജോയിൻ ചെയ്യാൻ താമസമുണ്ടെങ്കിൽ നമുക്ക് പരിപാടി തുടങ്ങാം. ഇടയ്ക്ക് ജോയിൻ ചെയ്യുമ്പോ
സാർ ഒരു ആശംസ പറയാം. സാറേ ഇന്നത്തെ ദിനത്തിന്റെ
ഒരു മിനിറ്റ്
എന്ത് പ്രത്യേകത ഉണ്ടോ?
ഡോക്ടർ എന്താ പറയുന്നത്? ഡോക്ടർ അൺമ്യൂട്ട് ചെയ്യും. ഷാജി കുട്ടിയ ഡോക്ടർ അൺമ്യൂട്ട് ചെയ്യും.
സ്വാമിജിയുടെ ആശ്രമത്തിൽ അവിടെ ഒരു റൗണ്ട്സ് എന്തോ നടന്നുകൊണ്ടിരിക്കുകയാണ്. ഞാനിപ്പോ തന്നെ പുള്ളി ജോയിൻ ചെയ്യാന്ന് പറഞ്ഞിട്ടുണ്ട്.
ശരി. അപ്പൊ നമുക്ക് പ്രോഗ്രാം തുടങ്ങിയാലോ?
തുടങ്ങാം.
അതെ, ശ്രീ അൻവർ സാമിനെ ക്ഷണിക്കുകയാണ്. സ്മൈൽ ലൈഫ് കോച്ച് ആണ് ശ്രീ അൻവർ സാം. ഇദ്ദേഹത്തെ നമ്മുടെ വേദിയിലേക്ക് കൊണ്ടുവന്നത് ഡോക്ടർ അജിനിയാണ്. ശ്രീ അൻവർ സാം തുടങ്ങിക്കോളൂ.
സ്മൈലി വിനിങ് കേൾക്കാലോ അല്ലേ എല്ലാവർക്കും?
കേൾക്കാം.
ഓക്കെ, വളരെയധികം സന്തോഷം. അന്താരാഷ്ട്ര മെഡിറ്റേഷൻ ഡേ, ധ്യാന ദിനത്തിൽ ഈ ഒരു കമ്മ്യൂണിറ്റിയെ അഭിമുഖീകരിക്കാൻ കഴിഞ്ഞതിൽ വളരെയധികം സന്തോഷം. ധ്യാനത്തെക്കുറിച്ച് എന്ത് പറയണമെന്ന് ഞാനിങ്ങനെ ആലോചിക്കുകയായിരുന്നു. ഈ ഒരു സെഷനിൽ എന്താണ് പറയേണ്ടത്? ഒരുപാട് വിജ്ഞാനം നേടിയിട്ടുള്ള, അതുപോലെ തന്നെ ജീവിതത്തിൽ എക്സ്പീരിയൻസ് നേടിയിട്ടുള്ള ഒരുപാട് ആളുകളുടെ മുമ്പിലാണല്ലോ സംസാരിക്കുന്നത്. അപ്പോൾ ഞാൻ ധ്യാനം പഠിക്കുന്നതും അതുപോലെ തന്നെ അത് എക്സ്പീരിയൻസ് ചെയ്യുന്നതും സ്മൈൽ മെഡിറ്റേഷനിലൂടെയാണ്. അതിനു മുമ്പ് പല മെഡിറ്റേഷൻ ചെയ്തിട്ടുണ്ടെങ്കിൽ പോലും എൻ്റെ ജീവിതത്തിൽ ഒരു ട്രാൻസ്ഫോർമേഷൻ വന്നത്, അല്ലെങ്കിൽ ജീവിതത്തിൽ ഒരു വെളിച്ചം വന്നത്, തെളിച്ചം വന്നതൊക്കെ സ്മൈൽ മെഡിറ്റേഷൻ പ്രാക്ടീസ് ചെയ്തതിലൂടെയാണ്. അപ്പോൾ സ്മൈൽ മെഡിറ്റേഷൻ ഒന്ന് ഇൻട്രൊഡ്യൂസ് ചെയ്യാം എന്നുള്ളതാണ് ഞാൻ ഈ ഒരു സെഷനിലൂടെ ഉദ്ദേശിക്കുന്നത്. അപ്പോൾ എനിക്കറിയേണ്ടത്, നിങ്ങൾ ഒരു മെഡിറ്റേഷൻ ചെയ്യാനുള്ളൊരു മൂഡിലാണോ എന്നുള്ളത് കൂടി എനിക്കൊന്ന് അറിയണം. അങ്ങനെയാണെങ്കിൽ ഒരു 20 minutes മെഡിറ്റേഷൻ, അതിൻ്റെ മുമ്പ് ഒരു 10 to 15 minutes ഞാനതൊന്ന് ഇൻട്രൊഡ്യൂസ് ചെയ്യാം. അതല്ല എങ്കിൽ മെഡിറ്റേഷൻ ഇല്ലാതെ ക്ലാസ് മാത്രമാക്കി കൊണ്ടുപോവാം.
അതായിരിക്കും നല്ല. കാരണം പലരും ഈ ആഹാരത്തിലായിരിക്കും കാര്യങ്ങളുണ്ടാവും.
ഓക്കെ. അപ്പൊ ഞാൻ അതിന്റെ കുറച്ച് സൂചനകൾ നൽകാം. സ്ക്രീൻ ഷെയർ ചെയ്യാലോ അല്ലേ? ഞാൻ തുടങ്ങുന്നതിന് മുമ്പ് സ്വാമിജി എത്തിയാ പറയണേ. സ്ക്രീൻ കാണാലോ അല്ലേ? സ്മൈൽ മെഡിറ്റേഷനെ കുറിച്ച് കേട്ടിട്ടുണ്ടോ? ഇല്ല. ഓക്കെ. ആദ്യം എന്നെ ഒന്ന് ഇൻട്രൊഡ്യൂസ് ചെയ്യാം. ഞാൻ സ്മൈൽ ലൈഫ് കോച്ചാണ്, അതുപോലെ ഓൺട്രപ്രണർ മൈൻഡ് സെറ്റ് കോച്ചാണ്, അതുപോലെ തന്നെ ഒരു ഹീലറാണ്. UK കോംപ്ലിമെൻ്ററി മെഡിക്കൽ അസോസിയേഷനിലെ ഒരു മെമ്പറാണ്. അതുപോലെ തന്നെ ഇൻ്റർനാഷണൽ സുജോക്ക് അസോസിയേഷൻ്റെ ഓതറൈസ്ഡ് ലെക്ചറാണ്. അതുപോലെ തന്നെ NLP, ഹിപ്നോതെറാപ്പി ഇതിൻ്റെയൊക്കെ പ്രാക്ടീഷണറാണ്. ഇവിടെ മെഡിറ്റേഷൻ എന്ന് സാധാരണ പറയുമ്പോൾ നമ്മുടെ മനസ്സിനെയും ശരീരത്തിനെയും ശരിക്ക് കാംനെസ്സിലേക്ക് കൊണ്ടുപോകുന്ന അല്ലെങ്കിൽ റിലാക്സേഷനിലേക്ക് നയിക്കുന്ന ഒരു കാര്യമായിട്ടാണ് സാധാരണ മെഡിറ്റേഷനെ കുറിച്ച് പറയാറുള്ളത്. എന്നാൽ എൻ്റെ ജീവിതാനുഭവം എന്ന് പറയുന്നത് ബിയോണ്ട് ദാറ്റാണ്. അതായത് നമ്മുടെ ശരീരത്തെയും മനസ്സിനെയും ശാന്തമാക്കുക എന്നതിനേക്കാൾ ഉപരിയായിട്ട് ജീവിതത്തിൽ വെളിച്ചം നൽകിയിട്ടുള്ള അല്ലെങ്കിൽ ജീവിതത്തിനൊരു താളം നൽകിയിട്ടുള്ള അതുപോലെ തന്നെ ഈ ലോകത്തെക്കുറിച്ചുള്ള കാഴ്ചപ്പാടിനെ മാറ്റിയിട്ടുള്ള ഒരു കാര്യമായിട്ടാണ് എൻ്റെ ജീവിതത്തിൽ മെഡിറ്റേഷൻ വർക്ക് ചെയ്തിട്ടുള്ളത്. അപ്പോൾ സാധാരണ മെഡിറ്റേഷനെ കുറിച്ച് പറയുന്ന ഒരു കാര്യമുണ്ട്. അത് പിന്നെ ടു അച്ചീവ് എ സ്റ്റേറ്റ് ഓഫ് ഡീപ്പ് റിലാക്സേഷൻ, അതുപോലെ തന്നെ ഡീപ്പ് അവയർനെസ്, അതുപോലെ ഇന്നർ പീസ്. എന്നെ സംബന്ധിച്ച് ബിയോണ്ട് മൈൻഡ് ആൻഡ് ബോഡിയാണ് മെഡിറ്റേഷൻ. അതിനേക്കാൾ ഉപരി എന്നെ